Hi, it's Casey. I'm back, and today here's a video on the difference between medical assistants and nurses. So hang tight. Hi, I'm Casey. I'm going to be your medical assistant today. Are you okay if we take some vitals? Medical assistant? You mean you're not a nurse? Aren't they the same thing? So why don't you just call yourself a nurse? Well, I'm glad you asked. You know, medical assistants and nurses are actually very different. And it's not something a lot of people know. So let's take a crash course into the difference between a medical assistant and a nurse. So first off, the biggest difference between a medical assistant and a nurse is that a medical assistant does more outpatient things, whereas a nurse is trained in more inpatient things. So what does inpatient and outpatient mean? And aren't I just the patient? That is a very good question. So think of inpatient as you're in the hospital and you have been admitted into the hospital for several days. Think of outpatient as when you go to the doctor's office for a checkup, or if you go to an urgent care, instant care, and receive just real quick help within a few hours. That's still kind of confusing. Don't you still do the same thing that a nurse does? Well, I could see where that could still be confusing. So there are similarities between medical assistants and nurses when it comes to caring for a patient. But nurses will learn some things more in depth, whereas medical assistants will learn other things more in depth, such as phlebotomy. So, you know when you go to the lab and you gotta get your blood drawn, or you get a shot. Medical assistants, we go through a whole semester of how exactly to draw blood and do injections, whereas nurses, from what I understand, I think they only get a few days of training. So I'll find nurses in hospitals and medical assistants in doctors' offices? Kind of. So you can find medical assistants in hospital settings as well. Typically, you'll see medical assistants within a doctor's office and urgent care, but if you see them in a hospital setting, they're doing more medical assisting type things, such as checking on the patient or just checking the vital signs. But if you see a nurse in a hospital, she's typically the one who is setting up an IV bag, or she is putting whatever medication that you have into your IV bag and things like that. So what kind of training do you have to do to be a medical assistant? Well, to be a medical assistant, you gotta go to school and you have to get some kind of training. Now, when you're searching for schools, there are gonna be several different ones because of the different certifications these schools can have, or I should say accreditations. When searching for a school, first off, you're gonna see ones that are advertised to be really fast, really quick, and you get your certification in less than a year. Then you'll see other ones like the one that I go to where it takes a whole year just to get the certification, and then some, depending on how quickly or how slowly you decide to do it. Some people go at a faster rate than others, which is completely understandable. To know more about these, see the link below. It'll give you a complete rundown of the different certifications a medical assistant can have, because there are several different kinds. So if that's the case, who are you certified through? Well, I'm going to be getting my certification through the American Association of Medical Assistants, otherwise known as the AAMA. And they have some of the strictest requirements when it comes to being a certified medical assistant. What stands apart is that this one is recognized nationally, and you actually have to go through an accredited school. And it has to be two different kinds of accreditation. You could have a Commission on Accreditation of Allied Health Education Programs accreditation, or you can have an Accreditation Bureau of Health Education Schools. And to get these accreditations, the school has to meet very strict guidelines in order for it to work out. Whereas other schools are mainly for-profit, so you pretty much pay a very large sum of money to complete school in a very short amount of time that isn't recognized by either one of those accreditations. So, where can I find a school like that? Because that sounds pretty cool. Well, to find a school near you, just visit the AAMA.com website. From there, you can find all schools that are accredited appropriately so you can have a national certification. So, what can I expect in a school like this? It sounds really strict, and to be honest, that's pretty scary. Well, they are kind of strict, but don't be scared. It's pretty much if you can take the time to study, do your classwork, and act in a professional manner, then you have nothing to worry about. Instructors at these schools are highly trained, and they are always there to see you succeed. They will do anything that they can to help you succeed. You can expect to have to buy a few supplies like a stethoscope. It doesn't have to be an expensive one, as well as some lab supplies and things of that nature, and of course, books and tuition. But it's not too bad, just you have to dedicate any time that you need for homework and studying. I think the studying part is the really hard part of it. So thanks guys, this is my video on the difference between medical assistants and nurses with a lot of emphasis on how to become a medical assistant and where to find more information for that. If you have any questions, feel free to leave a comment below. If you want to subscribe button is right there, one of those two, as well as any further links to help you in trying to find more information. They are also in the comment section, or in the comment section down below. Today's been great. I hope you have a great one. See you next time.